And so we are recording. So we are live now. We've got a lot of people logged in. All right, welcome everybody. I'm Councillor Glen Gower and joined today by Dr. Vera Etches from Ottawa Public Health. Thanks, Vera, for joining us today.
Thank you.
Before we get started, we have a ton of questions already from people. Before we get started, I just want to explain a little bit about how this webinar is going to work. First of all, I want to introduce our co-host today, Véronique Bergeron from my team in Stittsville. Good morning or good afternoon.
Hi.
Vero's going to be helping us. There's a live chat and there's a Q&A function on the webinar, so she'll be helping us out with that. So if you're just new to Zoom and this technology, up in the upper right, if you're on a laptop, you can toggle between speaker view and gallery view. I prefer gallery view because you get to see all of us on the screen at the same time and it's a little easier to watch. There's also a few buttons on the bottom of your screen. There's a Q&A button. So if you've got a question today for Dr. Etches, you can use the Q&A tool and type in your question. We're going to get as many as we can in today. I also have a bunch of questions that people have already emailed to us. So lots of questions. And there's also a chat, and we're going to be using the chat to share some links as we go, or if you have any comments or feedback as we go, you can use the chat as well, and we'll try to keep it as interactive as possible. And I always warn people or give the heads up that this is a live webinar, and we're all subject to the quality of our internet feeds, and who knows what will happen. I know at Véronique's house, every time someone runs the microwave in your kitchen, it tends to freeze up your feed. So anyways, that's the way it goes.
Yeah, I did put a note. I put a note on my microwave today that says, avoid using between 1 and 2. So fingers crossed.
All right. And Dr. Etches, you are joining us today. You're at it looks like you're at the office. Where are you today, Dr. Etches?
Yes, the Ottawa Public Health main office is right across from Algonquin College, just off of Woodruff.
Before we jump in, I actually thought, I'm kind of curious, what does a typical day or what does your job look like these days? What does a medical officer of health do during this COVID-19 pandemic?
Well, everything we do usually in public health, but it's really, really true in this response, is in partnership. And so we have a clear role around communications. That's important to the public, for people to understand what's happening, what steps should they be taking. We have a role around disease control, so making sure the healthcare system has the right testing in place, and that we then as public health staff can follow up on positive tests and identify the contacts of people who might have become infected and help them know what to do. We keep track of a lot of the statistics and the data to guide the response, and then we're connected to others. So the partnership extends to the city, which has a lead for meeting some of the human needs, the challenges around the social and physical, financial, I should say, harms that people are experiencing, to try to mitigate that. We connect with the hospitals and the long-term care homes to help them, have what they need to be able to manage treatment and outbreaks. And so those are the big buckets of work. Okay.
And do you typically work in the office, or do you work from home sometimes? How does that work for you?
I actually typically work from home. We're trying to promote that across the board. So usually I'm home working in my son's bedroom. I'm standing at work. I have a standing desk. When I work at home, I type on top of my son's dresser because that seems to be about the right height. And it's a challenge for all of us, trying to work in these new conditions.
Yeah, we're all making the best of it and adapting however we can. I wanted to jump in and just starting with questions because we've had so many, and I want to make sure we spend most of this call answering as many as we can. So this is one that came in by email from Jeanne, and she wanted to know, do you have COVID-19 numbers specifically for Stittsville? So could you talk about that? I know it's something we talked about at City Council a couple of weeks ago.
Yes, I'm getting a pad and paper out so I can also keep track of the questions for my team. We don't have boundaries around Stittsville and a number that we can give you right now. What we're looking at is being able to provide the public with some maps. So the maps would cover the whole city of Ottawa, and we would show, the density. We'd be plotting, the cases that have been confirmed, and it would show, by color, if there's a higher rate in certain areas. I haven't seen the status of where that's at. I saw an early draft, and the early draft showed me that there are cases all across the city, so certainly out of Stittsville, and that is consistent with what we know is that we're all at risk, and that's why we've been asking everybody to do the physical distancing, because if you keep that 2-meter separation, it makes it a lot harder to pass on the infections. And I can get into more of that, but in terms of the short answer is the maps are coming. So we'll make sure the councillors have that and can promote that.
Okay, I guess a related question, because we've got a lot of questions about where the cases are. So Judy, for example, asks about what are we seeing now in terms of cases in institutions like long-term care homes versus cases that are in the community. Is there any trends that you can share on that?
Absolutely. So typically our team puts up on our website, it would be under a place on our COVID-19 website that says, what's happening in Ottawa, what are the trends in Ottawa. The data get posted usually every day. I'm saying usually, I have to qualify it today because we've had a change in our database that we're using. And so you've just caught us in transition yesterday, today. But there's a daily report on the epidemiology of the outbreak. And in that we keep changing it all the time. We keep adding new ways of looking at the data. The new report, and you'll see it there from the last one that's up, it shows the curve of the lab confirmed cases in the community compared to the lab confirmed cases that might be in a long-term care or retirement home, as well as a community-based outbreak, because we have had outbreaks in workplaces. We've had outbreaks in a group home. So there's actually 3 colored lines that show the different curves of how the infection's going. And definitely the community-based infections are decreasing according to the data we have. I'll come back to that. And then most of the cases now that are being reported to us are from long-term care homes and retirement homes. So I want to say a couple more things about that, if you don't mind.
Yeah.
The first thing is one case in a retirement home or a long-term care home is an outbreak. We start to treat that as an outbreak as soon as we have one case. And then we are starting a surveillance project the province is supporting to do testing of all residents and healthcare workers in every long-term care home and retirement home. And so this testing is not related to outbreak management. Though we do testing for outbreak management, we wouldn't necessarily test the whole facility. This is yielding more cases. It's showing us there are asymptomatic cases in these settings, sometimes in higher numbers, unfortunately. So we can talk more about outbreaks, but when it comes to the community curve, the other thing I want to say about the community curve is that it's not the whole picture. We know that the lab confirmed cases of people in the community have been mostly restricted to healthcare workers, emergency services workers, because those are the priority populations who've been presenting for testing at our assessment center. And so again, good news, I think, today, this afternoon during my media availability, so you're getting early notice. We are planning to try to slowly open that up to the general public. If you have symptoms that could be COVID-19, to be able to present for testing or assessment. Not everyone who gets assessed is tested, but we would like to be able to offer that into the future to anybody who has symptoms, because we want to move into detecting more of the cases of infection in our community and being able to stop transmission in a more targeted way. It's a long answer.
I had 2 follow-up for clarification. In one of the questions that a resident sent, somebody was asking what a case meant, and I thought it would be, because this is a word that you already mentioned several times, and this this person whose name I forget, I'm sorry, I don't have the document in front of me, was asking, do cases include people who have had it and recovered? Does it include death? Does it include people who are actively sick? Like what do you, when we see a number of cases, what does that mean?
Thank you. And thank you for the reminder about the importance of language, because cases are actually people. You know, and sometimes in our public health world, when we're managing the numbers and the statistics, we just say cases, and we don't forget these are people, you know, family members and people. So the cases, when we say cases, it is people who have had a laboratory confirmed infection with the COVID-19 virus. So those are what's counted. It's when somebody's had the throat swab or the nasopharyngeal swab taken and a lab has not grown the virus, but detected the virus. And so we know that for sure that's a COVID-19 infection, we call it case. Now, some of those cases go on to be hospitalized. Some of the people go on to be, unfortunately, in the intensive care unit or die. And so when we list a death or a hospitalization, it's out of that group of people that have been, confirmed to have an infection. So again, it's not the whole picture, and we do have a separate way of thinking about probable cases. So if we're in an outbreak setting and there's a healthcare worker and someone in your room that were tested, and the person beside them was not actually tested, but they had respiratory symptoms, they had a fever, you know, we would call that a probable case because it's most likely, you know, COVID, even though we don't have the lab confirmed. And so we count probable cases as well in outbreak settings. Hope that answers your question.
Yes, it does. And what I was a second question to that, because we at the office receive a lot of questions from people who want to know how many cases in their neighborhoods and in their areas. And I always assume that because there's quite a wide range, there's often, health will often specify, like, we have so many numbers of people who have tested, but there's probably much more in the community in general. And I always thought that maybe knowing that there were no cases in your community would confer a false sense of safety when the virus is really out there and everybody should practice social distancing to the same degree. But I've seen other authorities where neighborhood maps have been released. And I was wondering, from a public health perspective, what is the utility, what is the purpose of having these more localized maps in a community?
Thank you. So as I say, they'll be coming soon to you. The downside of a map absolutely is that someone looks at it and thinks they're not at risk when we all could be exposed to the virus if we come into contact with someone else within 2 meters, because we know a lot of asymptomatic infection is happening. People can carry this virus without feeling sick and they can pass it on. So we do need to maintain that sense of protecting ourselves regardless. The utility of the maps, you know, going forward, maybe not the maps, maybe, but of geographical information, I'll say that is that we can maybe locate hotspots or places where an outbreak is occurring. Normally we do that through the interviewing and what we call case management. Again, it's a bit public health language, but we interview every person who has a laboratory confirmed test, and through that process we find out where they've been. So we have location information, and then if we find other cases who've been in the same location, we make the connection. Now a map can help you do that as well, and with large numbers of cases, you know, we're over 1,000, it can be harder to start to draw all the connections between them. And so we monitor that statistic. What's the percentage of cases where we have not been able to link someone's infection to another infection or a risk like travel? And so it's about 14% of cases so far. We have not been able to link them to an exposure to a case or something else. So again, that speaks to people don't know always where they're getting this infection. It's out there. So I will just say maybe one more thing. I know I'm taking probably too long to get through the questions, so maybe I could try to shorten them, get more questions in. The thing is, we are trying to also introduce an app that we hope the population will be interested in using, that will make it easier for us to have that geographical information if people consent. People would have to give consent to use the app. They would have to give consent to share any geographic data with us. But that would allow us to make links also potentially between cases more quickly who have been in the same location. So this is a tool we're looking to roll out and advertise, and hopefully the public will use.
I'm really interested in this contact tracing, the whole practice of that. Maybe if we have some time at the end, we could explore that a little bit more. But I wanted to shift to probably one of the top questions we got was around masks. And I'll just give you a sampling, Dr. Etches, and I'll let you comment on some of these themes. You know, Peter asks, when will masks be mandatory when shopping? Tracy asks, wouldn't it be beneficial to make them mandatory now? Eric asks, what can the city of Ottawa do to ensure there's a safe supply of masks? So I'm sure you've been hearing a lot of questions about masks over the last few weeks. Can you give us your guidance and what people should know about how to safely use masks and what we should be doing?
Sure, and I will recommend that people go visit our ottawapublichealth.ca website that has a whole section on masks. You'll find it as one of the key topics. If you keep scrolling down on the main page, you'll see masks. It's really a pretty comprehensive place. So first of all, what I would say is if you're sick and you have a respiratory infection, if you wear a mask, that is good because it keeps your secretions to yourself. And we've said that that's consistent. That's been the same throughout this whole response. If you're sick, wear a mask to protect others. If you're going out to get healthcare, for instance. Otherwise, I mean, if you're sick and you can manage, you should be home, right? That's part of self-isolation. But if you have to go out to get healthcare or something, then the mask. The concept then in terms of more widespread use of the masks now that is being discussed is that because some people don't know they're sick, because there are asymptomatic infections, we would recommend that people wear a mask if they're going to be close to others, if they're going to be within 2 meters of somebody else. And this is non-medical masks, right? So this is the other challenge around masks, is that we still do not have a really robust ongoing supply of the medical masks that our first responders and our nurses and our doctors need. It is still a supply chain challenge. They're working on it. They're trying to build their stockpile. They're looking at ways to reuse medical masks safely, and that can be done, but it still only extends their supply. So we have to continue to prioritize medical masks for healthcare. So these are non-medical masks. They can be cloth, they can be homemade. The Board of Health recognized that this is a measure that will protect our population. If everyone does it on a wide scale, it actually can make a difference. And so we want everyone in the city to be able to access a mask if they can, if they're going to need to wear it. And so that's part of what we're looking to do, is build up a list of suppliers and where you can get the mask or how you can make them yourself. I mean, some of this, the how to make the masks are very simple, out of a t-shirt, that kind of thing. So they aren't mandatory. And that is an interesting thing, in terms of culturally. I think if you look around the world, there are countries where they've mandated it. New York City, they mandated mask wearing as restrictions are eased. And so I think this is a good conversation to have. I don't think I said today we're launching a community engagement conversation with the community on the website. It's going to be through Engage Ottawa platform. And we're going to ask the community about masks in terms of your readiness to wear them. when you're outside the home. So in public health, we always try to start with the least restrictive or the least punitive measures. Like this is extraordinary what's happening right now, asking people to stay home. It's very difficult, and you know, people say the word is overused, but it's true. It's unprecedented. So we need to always think about where we can, you know, give people freedom as much as possible, and so it's a debate, you know, around where do you make things mandatory or not. I would say the population's done an excellent job. Like, so thank you to everyone on the phone, on the internet here. Thank you, because people have protected others. Like you have successfully slowed down the transmission in our community, and so I have a lot of faith in people wanting to do the right thing. Even in your questions here, I hear the desire to wear a mask to protect others. So I think that's great.
Okay, thank you. Another question we had, we're looking for themes in the questions, and people have a lot of questions about COVID-19 as compared to flu, to the seasonal flu. Murray, Scott, Carolyn, all very similar questions, and I think the easiest way to summarize them is can you compare the impact of the flu in terms of seriousness of the illness, or in terms of death, with what we're seeing from COVID-19? How do they compare?
Thanks. Yeah, we don't have the full picture yet. We will be analyzing this for a while. You know, people are always interested in the mortality rate. You know, does this kill more people, you know, than the influenza? The mortality rate's hard to calculate early on in a pandemic, and you'll see different estimates around the world because it's based so much on those cases. We talked about the laboratory testing that confirms a case, and then what proportion of those cases, unfortunately, are people who die. That depends a lot on what's happening in your society, how old people are. We know this is a virus that is disproportionately killing people who are over 70, especially over 80. So if your population's older, you'll have a higher mortality rate. It depends on what's happening with the state of your healthcare system. So we see higher mortality in Italy, where the healthcare system was rapidly overwhelmed. It does appear to be causing more mortality in long-term care homes when we have an outbreak. We don't usually, in a respiratory outbreak, in a long-term care home, an influenza outbreak, we get them every year in long-term care homes. We do not usually see this degree of death, unfortunately. Again, I can't be sure. It's just the severity of the virus. I can't be sure, because it could be also related to the trickiness of the virus in how it's hidden in asymptomatic infections and gets passed on before people realize it. So normally in an influenza outbreak in a facility, you know, the staff can tell who's sick, and they can take measures to isolate the people who are sick, and make sure they're always using the gowns and the gloves and the things they need, the masks that they need to protect transmission in the home. And it's harder with this virus because of the way some cases aren't obvious. So I don't have a definitive answer. It's certainly causing more infection, probably harm because nobody's been exposed to it before. So it's new. Nobody has immunity. Unlike influenza, every year a good proportion of us get vaccinated, which is great. And then also we have some immunity from influenza that's been circulating year over year for a while. So those are some of the differences.
I was wondering, so I have 4 children in elementary school, and I've noticed, you know, with all the challenges of homeschooling, that we're not getting ear pains and strep throat, and there's a whole bunch of little illnesses that we're sailing through. This has been a great winter for that. And so have you noticed, I'm sure you've noticed, social distancing for COVID must have had a positive impact in influenza as well, right? Have you seen a lower incidence of influenza in the population due to social distancing and COVID?
Yes, I believe we did see an impact when people started to physically distance. We did see the detection of influenza in the community also drop. Yeah, and I'm glad to hear that your family's been healthy. That's good.
That's great. We've had several questions from residents as well about basically immune system, immunity. I'm using this as a bit of a catch-all. So there's several questions about whether catching COVID-19 grants you immunity, and whether catching COVID-19 grants you immunity, and whether that immunity could be a factor of those asymptomatic cases, like, for instance, people having caught the virus before, so testing positive, but being immune to it. But we also have concerns about people who say, if we're not exposed to colds and flus, is our immune system weakening because of that? And I was wondering, and I know this is a conversation we had at the supper table yesterday with my teenagers, where they say, is our immune system weakening the way, let's say, a muscle would be weakening if we're not using it? And I was wondering if you could speak to that as well.
Okay, so a few things around immunity. First off, we do not yet have a test to measure that's in widespread use in Canada, in Ontario, in Ottawa. They're working on it. These are tests that measure antibodies. We call them serology tests. And that would tell you if you have antibodies to COVID-19. Usually when someone has antibodies, they have some level of protection, like some immunity. So we don't know that yet. That also has not been proven. Nobody has said if you have this level of antibodies, or we measure this antibody, we know how long that immunity will last or how robust that immunity is. There's just not data on that yet. But we would expect some, we would. And whether your infection was asymptomatic or laboratory confirmed, it would be the same. We would expect the same kind of immunity if people have been exposed to the virus and then cleared it, got better, which absolutely most people do, right? Most people encounter this virus, their body takes care of it, they move on, and so the challenge is, I'm really looking forward to these immunity tests. I'd love to know what is the proportion of our population that's been exposed. And my understanding is that the province is going to be doing those tests in terms of a surveillance kind of system to see like what is the level of immunity across the province, different communities. We're not there yet. So the estimates, we have to estimate this based on the proportion of the population we think might have been infected. And these are all, different ways people try to estimate how many of us have been infected. And it's based on modeling. Sometimes it's based on extrapolating from the number of hospitalizations or death. All of them have problems. And so, what I have right now from my team, the best estimate is that the laboratory confirmed cases are maybe 5 times to 30 times underrepresenting the actual cases that are out there. So that's a big range, right? Sorry, between 5 times. Say that again?
Sorry, I was asking because we also had questions about why is there such a range between the laboratory confirmed cases and what could be in the community?
Because we don't have an actual measure. We have to estimate it based on other assumptions, right? So there's a lot of different assumptions about how likely is it that 1 case gives rise to 2 cases or 3 cases? How likely is it that there's a level of asymptomatic cases that aren't detected? There's a lot of different measures that go into models, and each of them has assumptions built in. So It gives you a range, which I think is appropriate because you don't want to give the sense that you've got the answer when you don't. So the question about immunity, the second part was about right now, I guess this is what my understanding of the question is. Right now, because we're not going out and we're not getting exposed to viruses, is our immune system sort of losing its capacity to tackle viruses and other things? I would say no. No, it's going to deal with whatever we face, you know, next month, next couple of months, when we get back out and we start encountering viruses some more. Our immune system will handle that. Now, we might have to catch up. Maybe there's a virus that was circulating that we would have normally got in February, and now we're going to get it in June. But our system, you know, the immune system, usually when people don't have challenges to their immune system, can handle whatever comes by.
I wanted to follow up just on the testing, because we had a lot of questions about testing as well, and you've actually covered a lot of what people were wondering about. But there was one question in particular, and the number of people we're testing continues to grow because we're expanding the test criteria. But at the same time, what the Ontario government had said was we want to see a decrease in the number of new cases over a few weeks. So the question is, if we're testing more and more people every day, aren't we just going to constantly see more and more positive cases? So are you looking more at, what was the question? Are you looking more at like the positives per test as a number, or can you just explain a little bit about how public health officials are evaluating that growth in positive cases and really what you're looking for to help you make decisions about next steps?
Good question. Okay. My first thing I'll say is that we never look at one measure, and the province won't look at one measure either. So each of the measures has pros and cons in terms of trying to decide when is it safe to relax restrictions, which we're all interested in. We all want to get there. So let me start with the testing numbers. You're right. If we keep testing and expanding the group we're testing, and we say now more and more people from the general population can present, you know, to be assessed and possibly tested, the testing numbers will go up. But if the infection in our community is decreasing, which we believe it is, then the percent of tests that are positive will drop. So maybe at the peak, you know, we might have seen, sorry, I should have these numbers, but I don't, you know, 8% positive, and then we might see it drop down more to like 2% positive. The other thing is, so counting the positives, if the infection in the community is dropping, it still should continue to drop in proportion. So we should see that. So what I like to look at as, to me, like one of the most reliable indicators I've said in other places is hospitalizations, because it's hard to get sick enough, you know, to fake it that you need to be in the hospital. That normally people don't do that. And so there's a certain proportion of people that are infected that will need hospitalization, and that proportion doesn't likely change. And so if we're seeing hospitalizations go down, it seems that probably reflects infection in the communities going down. And that is what we've been seeing for a little while, until we got some of the more long-term care home outbreaks and people are being transferred to hospital from long-term care, but that's a separate population. A separate population, but not. So then that leads me to another measure, right? So we're looking at tests, we're looking at hospitalizations, we're looking at outbreaks. So if the number of outbreaks is growing, that's not reassuring. That suggests that there's also infection in the community that is being introduced from community members into settings where there's congregate care and there's a risk of an outbreak. And so that has happened. That's usually what's happening. Is that they're linked, right? So the community and places like long-term care institutions are not totally separate, even though the risk of outbreak is much higher. So we do want those also to be under control.
Okay, so you've got all sorts of data and signals and things that you're monitoring as you make each of your decisions going forward. I think that's interesting. One more question about testing before we move on to the next topic. Do you have any sense of when there is more widespread testing, or even when there's more sort of sampling within the community. Do you have any sense of how that would work? Would that be through doctors? Would that be through taking over a recreation center in Stittsville or something? What's your sense of how that would roll out?
Well, the easiest thing to do right now is to open up the assessment centers that we have. But I would like to see that any primary care setting that normally provides care for their patients would be able to do the testing, so that in the future, as we get more primary care offices back online, my understanding is a lot of them are actually finding it hard right now to practice because they don't have all of the masks and things that they need. So that's a provincial conversation that's been ongoing, is to make sure that they have what they need. A lot of primary care physicians are helping out in different ways, helping in long-term care homes, other things in different ways. So I think it'll be a gradual shift, hopefully, from needing to use like a city facility to getting back to a more normally functioning healthcare system. So the swab, it's either a throat swab or a nasopharyngeal swab, that can be done in a primary care setting.
Well, I know, I thought it was interesting too, a little bit different, but for the long-term care home, for the response there, it was Ottawa paramedics who went in over a weekend and helped with the testing and assessment of long-term care homes. So it really is all hands on deck to respond to this. Yeah. Want to shift a little bit. I know you've been getting a lot of questions from everyone about what does heading back to some kind of normal look like? And I just want to give you a few more comments and questions. But Peter says we should be able to hit some golf balls. Go out and hit some golf balls outdoors. That doesn't seem like a big risk. Or Mary asking, when can we contemplate opening up businesses like hairdressing salons so we can all get a haircut? Jerry wants to know, is there a safe way to reopen libraries? Paula, will curling clubs in Ottawa be able to open this fall? So a whole range of comments and questions we've had like this. Can you talk a little bit about how you're planning for relaxing some of the restrictions eventually and what that might look like?
Great. Yes, I really appreciate the chance to hear people's interests. And again, this is going to be an opportunity for everyone to put more of those thoughts into the Engage Ottawa platform. Let us know. The way I think about relaxing restrictions is I think about what are the criteria that need to be met first, and then how do we go forward, and what are the roles of different governments, I would say. So first of all, I think there's a lot of agreement around the world, federally, provincially, locally, across Canada. The kinds of things we need to have in place are the same. We need to have transmission of the virus controlled, so those decreasing rates of infection. We need to have a healthcare system that can manage enough beds, enough ventilators, enough personal protective equipment. We call it PPE, but the masks, the gowns. We need to have outbreaks that are managed, and we need to have a public health system that has the capacity, and we don't do the actual testing, but a system that allows the testing to be done to find anybody who might have COVID-19. So anybody who is symptomatic can be tested, and then the public health capacity to follow up and do that case and contact management. And we need a community that understands and is clear about what's being asked of them and is ready to participate in changing the restrictions in a safe way. So community engagement is an important criteria. Then what we are looking at is probably the province will make most of the decisions in Ontario. There will be some very important federal decisions that are made. Try not to touch my face. There'll be some federal decisions around travel in and out of the country that will be really important, and that is a risk, ongoing importation from countries where there's no control. So we need to have that. Provincially, they'll probably be starting to move. We get signals from the Premier, right, that they're feeling that there are some things that are low risk that we can probably start with in terms of smaller gatherings, outdoor activities, and then moving up into things that are higher risk, larger gatherings, more confined, businesses. So I think that concept is probably fairly universal, and there are people who, like in the United States, have done some good work around assessing specific types of work. So somebody mentioned hairdressing. That's considered a bit higher risk because you're in close contact with somebody, but it's not highest risk because it's small numbers, right? So you're only seeing one person at a time. Libraries actually seem to not be considered too high risk either, because people can maintain some distance, I guess is the thinking, that people aren't in close contact like you might be in a restaurant, say, not talking face to face as much. I know it all depends on your family and the children. I'm thinking of those kinds of things. But so golf is one of those outdoor activities, right, where you can be more separate from others. And so I think the curling clubs, usually you're in close contact with a team, so more than one-on-one, but it's not huge crowds. So I think this is the kind of assessment that will be going on. Mm-hmm. When you think of the risk associated, it's really related to the risk of transmission. So how many people and how close of contact, but you can mitigate that risk. And so this is where the masks come in again, and barriers and other things that could be new ways of doing business in our community. And it's going to be an ongoing conversation, but I think that the province has just come out with some guidelines for businesses about how to try to follow the example of the grocery stores and think about physical distancing in the workplaces, which is important. So if you can decrease the risk with these kinds of measures, that also allows us to feel more confident opening up activities.
Yeah. So I'm just going to pivot a little bit to a different topic we've heard from several people, and that's the Spartan bioscience test. And so I think this is, you probably know more than I do about this, so I won't embarrass myself. But some people would like to know if this test is, if you have any news, and if we have a specific question from Dr. George, who is a dentist, who's asking if dentists can be involved in the testing, and if saliva tests are an option we're considering. So I hope you can do that.
Sure. So I think it's excellent. We have an Ottawa company that's developed a test, and I'm not an expert in laboratory tests, so I actually don't have a lot of detailed expertise to contribute to like evaluating or commenting on specific tests. So I'm sorry. What I can tell you is this is being examined by the province. So I know that the province is looking at these kinds of tests, probably this specific test, I'm not sure, and how they can be used into the future. So I mentioned that a little bit earlier, trying to have tests for immunity, trying to have rapid tests, saliva-based tests are one of the things. My understanding is they're all being studied. The problems that arise, and I don't know if it's this specific test or not, the problems that arise are if you have what's called a false negative. So somebody is tested and they're told no infection, they might very well go on to do some high risk things and could infect people, and that's a problem if it happens too often. Sometimes nothing's perfect, but if it happens too often, that will not help us control spread of the virus. It will cause challenge. The other thing is if it causes a false positive, so somebody's told they have the virus when they don't, for some of us that wouldn't be a huge burden in terms of we'd have to stay home for 14 days. But for others, it could be very problematic if it affects your work, or if it's in a situation where then there's an outbreak declared. Like I said, one case in a healthcare worker leads to an outbreak being declared in an institution. So there could be a lot of implications for false positives as well. So that's what they try to test against and evaluate the test to see, are those levels that we're looking for going to be useful or not.
Thank you for that. Dr. Etches, we have under 10 minutes left. So we've had a lot of questions come in, and I
I
thought we
forgot to fill up my water.
Oh, no. Well, I thought in these last few minutes, we could do really a rapid fire and just try to
Sure.
get
Okay.
some questions that were hard to fit into categories. So I'll ask them quick. We'll go back and forth between our emails and our chat and Q&As. So one of them is looking for clarification. Someone has heard that that public health has recommended that elevator buttons be regularly cleaned, but that the buttons at crosswalks are okay. Can you talk quickly about the risk associated with each of those, elevator buttons and crosswalk buttons?
Yeah, it's so interesting what comes through. They're both a risk. You know, if you touch a button to cross the road, somebody might have touched that ahead of you. It's possible you could then touch it and pick up the virus. The same as if someone touched an elevator button ahead of you and then you touched it. I think the difference is in a building, we're recommending cleaning the elevator buttons because that's feasible. That's something you can do. It's reasonable. If you do it frequently, it can make a difference, you know, in the amount of virus that's there. We can't clean all of the buttons on the street crossings, right? That's not feasible. So the underlying message is, it's actually not about whether that's a risky thing to touch the button. It's a risk. It's possible in both situations. The underlying message is you need to assume and wash your hands and don't touch your face unless you've washed your hands, that they are risky. And so, you know, I've seen a lot of people use their elbows, which is great. I've seen people use sticks. That's all fine. The main thing is keeping your hands away from your face if you haven't just washed them. And so I hope that clarifies. It's not really a contradictory message. It's just, you know, where you can keep cleaning up, it's a helpful thing to add in.
Mm-hmm. So I have a question from Jeanne, who's asking if pulse oximeters are used for triage of potential COVID-19 cases here in Ottawa.
So this is about measuring the oxygen saturation in somebody who might be infected. It's really interesting. There's suggestions that people's oxygen level drops before they realize they're short of breath. So there is no promotion of these measurements in the general population at this time. Whenever someone goes to emergency room, it is one of the things that gets measured. So if people present to emergency, they will measure your oxygen level.
Okay. A question from Joseph. He says, our church parish is considering having the entire church cleaned and sanitized, even though it hasn't been occupied in over a month. Is that the right thing to do, or should we just focus on washrooms or the church office to be deep cleaned?
I think this question relates to how long can the virus stick around?
Yeah, yeah.
And so the virus is not likely to survive more than a few days. You know, if people want more information on this, we can maybe follow up too, because I know there's stories about a cruise ship where it lasted 3 weeks, or, you know, I'd have to get my team to look into all the latest science, but I think the reviews of the literature suggest that it depends on the surface and it depends on the environment. So if it's a perfectly humid environment with the right temperature and, you know, really smooth stainless steel, it can last for longer, you know, maybe longer than a few days. But on cardboard, it's been shown it doesn't last more than 24 hours. So yeah, always with cleaning, the most useful places are the places that people touch the most.
So we had a question about newspapers. Someone gets their newspaper delivered at home every day and wants to know what's the likelihood of catching the virus from their Ottawa citizen.
Yeah, it's very low. Yeah, so the thing is, if you're really fearful about it, if you're concerned, you can just let it sit for a day, and, you know, that would be fine too, right? I guess people like their news the same day, but it's just unlikely. As I said, on cardboard, which is like paper, you know, it didn't last more than 24 hours, but just the likelihood of the deliverer being infected and having a lot of, you know, respiratory secretions on that paper is unlikely. We're asking people to stay home when they're sick. You know,
I was thinking, like, when I was reading when I you read newspapers and your fingers get dirty. I was thinking how we've already learned not to touch our face after reading the paper.
Right, right. Sorry, that's the other key message. Yeah, that's right.
You touch your face with your
Yeah.
newspaper. We also had questions about we went in lockdown to not overwhelm the healthcare system. We get a lot of reports of our emergency rooms being empty, and so can we conclude that we're not overwhelming the healthcare system, and could that be an indicator for returning to normal?
Absolutely, that's the measure about our health system capacity. Yeah, and we're in good shape there.
And we have
except for personal protective equipment. But and people, if you think you need the emergency room because you have something serious happening, please go. They can definitely accommodate you. They want to see you. If you have chest pain, if you have a unexplained headache, shortness of breath, please go.
This is from Gary. He's heard that in New Brunswick, they're allowing 2 households to get together as a step back from total physical distancing. Can you comment on that? Will that be coming to Ottawa anytime soon?
I love the idea. I think it's really great. I had been talking about it before New Brunswick mentioned it too, as a kind of possible way to get past some of the real harm of social isolation, especially for individuals who live on their own. If you can pair up with another household, at least you have the ability to socialize, which makes a difference without greatly increasing the risk of transmission. Everything can increase the risk of transmission. Then you have 2 households meet up with another person who's got 2 households, and it grows. But this is what we're hoping, is that it's going to be manageable, and we'll have to monitor and we'll have to measure and see.
And you also mentioned that transmission was through droplets, and David asked if that includes sweat. Can the virus be transmitted through sweat?
No, not that we're aware of.
We probably have time for 2 or 3 more questions. There's one from Liz. Should she be washing her groceries when she brings them home from the store? Yeah.
If you can, it's an added layer of protection. What we're advising people when we go grocery shopping is actually, it's a good information on our website, how to do your grocery shopping safely. That's another one of those key topics. We're asking people not to touch things as they shop. So we're asking everyone to just look at things and, try not to do what you would usually do in terms of picking something up. And so we're asking people to wipe down their grocery cart before they use it as well. It's different things that would decrease the risk of anybody else's respiratory secretions being on the things that then you're going to use. You obviously can't wipe down everything, but some things you might wash anyway in terms of fruits and vegetables. And if you can, it's not a high risk. Again, for the same reasons that we're asking people who are sick to stay home. And it would require somebody to have exposed the items, and then you pick them up.
Oh, my turn. We had a question from François about riding a motorcycle. Like they say to stay home other than for essential errands. What's your opinion on, François asked specifically about riding a motorcycle for pleasure, but I think that would apply to people just go on car rides for a change of scenery where you're physically distant, but it's not technically essential. So what's your opinion on leisure car rides and motorcycles?
Yeah, I think everyone's been doing a pretty good job. We have been successful collectively at staying home and decreasing, interaction with others. It's made a difference. So, it's as much as possible. The more we do it, the more it helps. But we can't just stay home. It's not good for us, And so all along I've said, get outside. Go outside for a walk, go outside for a run, go outside if you need to use your motorcycle, because that's what helps you with your mental health. Do that. I think we have to be reasonable.
From Jeff, actually, I'm going to paraphrase his question a little bit because we hear a lot about this. Let's say you're out on the Trans-Canada Trail on your bike or jogging, and someone passes by you within 2 meters. How big of a risk is that?
It's low risk. So you're passing quickly, you're going in opposite directions, or someone passes you from behind. you know, you're not in close contact for very long at all. What we see with this virus is it spreads where people are in close contact, like face-to-face conversations for a period of time, living in the same room, living in the same household, working in the same workroom. Like these kinds of close environments where people are within 2 meters of each other in a longer way. So is there a theoretical risk of transmission because somebody's respiratory viruses could somehow, you know, be coughed out and carried to you? It's possible, but it's very low. And you know, we're not seeing, you know, when we look at documented outbreaks, we're not seeing them related to trail use, for instance.
Okay. Okay, one more question. I think this is a great question to end on. It's from Jeff. It came in by email. He says, thank you, Dr. Etches, for your continued leadership from the beginning. I think it's safe to say that a lot of young people have seen your work, your scientific reasoning, and your actions taken and view you as a role model. Do you have any advice for people who might be thinking of starting a career in public health?
Thank you. I love public health because you can work on keeping people well. You know, you can prevent bad things from happening. And because you have to do it in partnership with people. So public health is all about, you know, working with city councillors, working with community leaders who just want to make their communities better. And so I do find it inspiring kind of work. And I would encourage people, if they have questions, in a normal situation, I would invite people to give me a call or email, and I can chat with them more about it as a career. I hope we'll get to that place again soon.
All right, we're going to have to wrap it up there. We're out of time. Time flies. Thank you so much.
I'm
Merci.
going to get some water.
Okay, good idea. Stay well. You always tell us to stay well. I want to tell you the same thing. We do appreciate everything you and your team have been doing. Thank you, Véronique. Merci pour votre aide cet après-midi. And have a great weekend, everybody. Thanks for tuning in.
Thank you.
Bye.
Thank you.